Good afternoon, everybody. Thank you very much for joining us for the live session, or if you're watching online, thank you very much for your time as well. If I'm correct, this is the third session of the second day of the Professional Care Workers Week. And today with me, I have Paul Bridge from Civitas and Storm Postlethwaite from Discounts for Carers. Thank you very much both for joining me this afternoon. And you are both great supporters of the charity and our work. You sponsor us and you make sure that we have the money to deliver the work we need to deliver. And what I wanted to discuss with you this afternoon is, why do you support the Care Workers charity? Why do you think well-being of care workers is important? And any other work that you might be doing around care workers. So if it's okay with you, we'll start. I'll do it one question at a time. And if you could just, share your opinions and views about the workforce, that would be great. So Storm, if I could start with you first, please. Could you share with us, why did you decide to support the Care Workers charity?
Well, I think the Care Workers charity is really aligned what we do at Discounts for Carers. So Discounts for Carers were really supportive of trying to improve financial well-being for carers, and we do that through supporting, through helping them save money through the discounts that are available on our website and through our scheme. And I think that's really aligned what you guys do at the charity, and that you're helping trying to improve financial well-being for carers. Just to sort of give a bit of context about what we do at Discounts for Carers. So we have a platform available for care workers to sign up to, and through the platform, carers can save around 1,400 different brands. So that includes brands like JD Sports and Adidas, which are really popular with carers, but also things like Travelodge, Haven, Jet2 Holidays, Hotpoint AO, lots of different high street brands, and across lots of different categories as well. So home and garden, travel, holidays, fashion. Our members can save at multiple different brands. And currently we're supporting around 400,000 carers through our scheme, but we're really aware that there are a lot more that aren't aware of what's available to them and the savings that they can be making.
Lovely. Thanks a lot. And Paul, why did Civitas and you decide to support our charity?
Thanks, Karolina, for inviting me. Well, Civitas invests in social housing, and of the 12,000 people that we house so far, all of them have significant care need, and their care needs are carried out by, we work with hundreds of care providers, and we're also involved in owning a care provider ourselves as well. And I think when I saw the charity, I was just really impressed with the ethos. And also I think that from a personal point of view, we still don't seem to have got right how we think about people who care in the country, because actually it seems to me that it's an absolutely very high skilled profession, and requires enormous amounts of dedication, but also different skills. And we undervalue it in every respect. And that's not a political point, it's a kind of societal point. So when we also like the fact that you're a very accessible charity, you're not, I'm not being critical of any other charities, but you don't have a huge infrastructure to support, when we put, we've only recently started working with you, but what we can see is that what we put in very directly goes to helping people, in our case, with mental health on a particular program we're supporting. And that's very important to us, because we are a large fund, but we want to work with charities who we can see that we're supporting specific activities. So we're really looking forward to it. I think we've agreed a 3-year program so far, and I hope it will last much longer than that. And it's really exciting to see where it where it will go. And I think also you personally have raised the profile of the charity a lot since you started. And, you know, I think when I think back to how little impact COVID had on our residents, that was largely because of the quality and the dedication of the thousands of care workers that work in our buildings. So, you know, I think it's the very least we can do, really.
Lovely, thank you. And I suppose this ties in very nicely with my next question. Our work at the charity supports well-being of care workers, whether, you know, it's financial, physical, mental health. Why do you think it is important for care workers to be well? So why, and to an extent, why do you think the work that we do as a charity is important? Because I think there's an issue with the wider society with pretty bad perceptions of social care, lack of respect and recognition of what care workers do. You know, in supporting our charity, I can say, you know, that you definitely understand that things are quite different and care workers should be supported and that they do matter. So why do you think well-being of care workers matters? Paul, if I start with you, please.
Well, first of all, I think that all employers should have a duty of care to their staff. And, you know, I've worked for many decades running housing associations and other types of organisations, and I've always been very passionate about, you know, caring for individuals within a workplace. I mean, on a completely mercenary point of view, happier workers are likely to be better performing, and you know, in particular in the care environment, obviously, if you're struggling personally, it's going to be more difficult to support others. But I do think there's a kind of, you know, it's a moral issue here as well, that it seems to me that, you know, I've never done care directly as an individual, but I've met many hundreds of people who have, and it strikes me that it's a very rewarding profession, obviously, not necessarily financially, of course, but in terms of the sense of feedback. But it's not necessarily the easiest at times. And, you know, if you're an emotional person like me, then if you're caring for somebody else and it's, you know, it's emotional, and that's it, that in itself is, takes energy, and sometimes that energy can be reduced, and it needs to be topped back up again. None of us are, you know, none of us are kind of islands. You know, we need to have our resources topped back up, and also other events in your life can sideswipe you and prevent you from functioning. I mean, that happens to all of us, unfortunately. That's out of the blue sky type thing. So I think, it's incredibly important. I don't, you know, I would say that most of the care providers that I work with are quite explicit about looking after their staff, because they see that also, if you look at the costs of recruitment, the costs of retention or failing to retain, and all of that kind of attritional cost in a very competitive labour market, it makes no sense to not try and look after people. But that's a very commercial view. The human and soulful view is that, obviously, you know, it's an absolutely prerequisite that good employers think about people. And I think also, when we think about mental health, which is a particular passion of mine, we do have actually a society now where mental health is quite openly talked about amongst famous people. And it is not unusual now to read of an individual who is quite famous and 10 years ago probably wouldn't have been open about their mental health and now is. I don't think we've got there with normal people like you and I. And I still don't think there's openness to that in our country about mental health. We all see the stats, but we don't see the real issues for people on the ground. And actually, it's, you know, it's a bit of a cliche that if you've got a broken leg, everyone can see it. But if you have a mental health issue and you don't talk about it, then people can't see it. And so I think that's why they're particularly keen on supporting those activities.
Thank you, Paul. And same to you, Storm. And if you could also share, why was the decision made to run discounts for carers? Because, I know you do other professions as well, but with a particular focus on carers as well.
Yeah, so I don't think I've got much more to add because Paul's answered that question really well. I think when you first asked it, my sort of initial gut feeling was around, I think well-being is important for every worker, no matter what profession you work in. But I think especially for care workers, because they often prioritise other people's well-being rather than their own. Sometimes their own well-being can suffer a bit more for that. And like Paul said about sort of preserving energy for yourself and making sure you're well is really key in helping you do your best job. In terms of sort of our scheme and why we launched that, so originally we had one scheme called health service discounts, which was created for people who work in health service, obviously. And what we found was that we were getting an increasing number of carers coming to us through customer service and on social media, asking if they were able to join, and there were people who worked in the care sector. So as a bit of a test bed, we allowed carers to join for a period of time, and then we actually decided, this is quite a different group of people, and we wanted them to have their own dedicated scheme, which is when we created discounts for carers in 2018. So it's been running for about 4 years now. And what we are finding, what we can see in our data is that at the minute, more and more carers are turning to us for help and support, and we think that's very much linked to the cost of living and what's happening there. So in August, we had the highest number of users that we've ever had, and that includes obviously a few lockdowns over the past sort of 18 months and high streets being shut. So compared against those periods, we've got more people than ever trying to use our services. And I was just going to sort of touch on some research that we did as well, which I think is quite interesting. So quite recently, we did some research that compared a group of members, so 1,000 members against 1,000 non-members, to understand the differences between the two. And the sort of basis of that research, we asked carers about their current financial situation. And it was really shocking for us to find that 41% of carers described their current financial situation as either making ends meet but no more, falling a little bit behind and relying on credit, or heavily in debt. So we know that sort of element of financial well-being is really important for carers and something that's a real key issue. And just throughout the research that we did, so we were looking at the impact on our schemes on care workers. And in the research, we found that members told us they were saving on average £188.50 every month, which is obviously around £2,200 a year, which is huge for somebody who's a carer. And we also asked them sort of questions around well-being and quality of life as well. And actually 91% of members told us that our scheme allows them a higher quality of life than they would otherwise be able to afford. 46% of members told us that they feel more loyal towards their role and sector because of their access to our scheme. And 10% told us that they were happier going to work than non-members, which is obviously a real key thing. So yeah, I thought it would be really interesting to share those sort of facts and what we've found and how it's affecting the well-being of carers.
Thank you, and there's some very interesting data that you've got then. And just to confirm with you, for anybody who's watching, the scheme is absolutely free to join. And people can sign up online.
Yeah, it's free to join and it's free to use, and it works pretty much like if people have used Voucher Cloud or voucher codes. You just access the site and you get your code and you make your purchase, and you'll get the money off your purchases.
Great, thank you. And Paul, are you involved in, or are you aware of any other work that supports well-being of care workers that you'd like to share?
Well, that's I was just listening to Storm. There's some really good statistics there, and that scheme sounds fantastic. Not specifically, but I mean, because obviously we work with over, as I said, hundreds of care providers. There's lots of different things going on. I mean, I think as an employer myself, and also as a someone, as I said earlier, passionate about enabling people to thrive wherever they work, and whatever they're doing. I think what you are seeing is an increase in approaches to training people internally around mental health, to try and obviously providing access to external services, but also skilling up staff internally who are particularly passionate and interested. As an aside, I'm setting up a charity around suicide because I lost a friend who, and once you go through that process, you realise all the different aspects of it. And one of it is around, particularly post-COVID, how to socialise further openness again about mental health and mental health challenges. And really going back to Storm's point, as we know, the link between financial difficulties and mental health is absolutely inexplicable. It's there. If you're not secure, if you're worried about paying bills, and obviously we do have a cost of living crisis, and we do have quite rampant inflation. And actually, I think inflation at the moment doesn't reflect basic goods. I suspect many basic goods are going up faster than some other things, discretionary things. So all of that mix means that we are going to see, and we're already seeing many more additional stresses and strains, which is why I think the roles that you both play in those different organisations are absolutely vital. I mean, I think, if you'd ask me what I'd like to see, I do think we need to reset, the NHS and workers in the NHS may or may not be properly rewarded, but they're certainly generally regarded very highly in society. And there is a general, I think everyone individually, when they have a relative or a friend that's receiving care, really appreciates what's happened and the benefits. But I think overall, the sense around care is rather negative, and obviously there are poor examples of care, but really in comparison with the amount of care that's being carried out, I'm sure they're very small. And I think if you're going to work and you want to be in something that's valued by society, you want to be doing something that's valued. So I think the work that we all do to promote the needs of care workers is really important. A lot of platitudes there, I'm afraid, because I don't have the immediate answer.
Oh no, not at all. I think it is all very important to say, and as a former care worker and the roles that I had in the past, I've always been a big champion of recognizing care workers and the importance of the work that they do, both to people that they support, but also to the wider society and the economy. So it would be
sorry, you just triggered something in me, which of course is championing social care, which you obviously know a lot about, and we participated in that recently. And I thought that was fantastic because I think it involved hundreds of care homes. I went to a care home myself, and it involved well over 100 MPs, and got local MPs to go and see a local care home. And I thought that was a really good initiative in terms of breaking down the barriers and the understanding.
Yeah, definitely. And Storm, talking about, more general perceptions of social care and care workers, do you have an opinion on why do you think it might be so low? If there's anything from your point of view that we could do to improve on that, and why do you think care workers are important?
I have absolutely no idea why it's so low, because I think, just like Paul said, I think it's really clear how much they contribute to society and everything that they do. And that whenever I think of people that work in care, I just think they're amazing people. Like, you have to be a certain breed of person to do that job and give themselves to that profession. So yeah, I don't have the answer to that in terms of why it's so low, but I think, like Paul said, more can be done and more should be done to help raise the profile of the care sector and the workers in the sector as well. We are actually sort of trying to work with government as well and policymakers on trying to raise the profile of what's available to them to try and help improve recognition and retention in the sector, which is something we're trying to do, but everything, as you probably know, moves so slowly, and it's really hard to get the attention of the right people. But yeah, I think a lot more could be done to help progress that further from all of the sort of powers that be. I forgot what the second part of your question was.
No, just in general, like, you mentioned you're working with policymakers around improving perceptions. Is there anything that you think we could do to improve perceptions within the general public?
Well, I might be wrong, but I feel like over the past couple of years that because the sort of care sector has been put under the magnifying glass quite a bit more, especially going through the COVID period and everything that care workers had to deal with things changing all the time, having to sort of shield and protect patients and that kind of thing. I think what care workers do sort of was really put under the spotlight there, and how much they give to society. And I think potentially that could help in the seeing that and having that front and centre is really important for those that don't work in the sector. But we've still not seen that come through the other side in terms of the right amount of recognition and reward for care workers, which is the next bit that needs to come after that, isn't it?
Lovely, thank you. That's really all the questions I had for this afternoon, because it's very obvious that you both know the importance of the work. Because it's interesting to hear your point of view of it, because we do have a lot of providers and other stakeholders in the week, but from companies like yours, it's interesting to hear a different point of view. Is there anything that you would like to add around importance of well-being of care workers, or the social care, or the workforce in general?
Well, I think, as I said, we really are very, very proud of our partnership, which has just started, and we're looking forward to seeing how it develops. And I think, I'm not a healthcare expert or social care expert, but I've now been interacting with that sector for about 6 years. It's very interesting to see, because there are also actually a lot of care owners, as you know, who started from scratch and personal experiences. They're not all big entities, and so it is. I think it will come. Actually, the Storm was saying, I think the appreciation of carers will improve. I guess the more that you can push for recognition and professionalisation, it is a professional sector, but recognising that it is getting recognition that it is. It's absolutely vital. I mean, I think if you look at the long-term trends, obviously Britain is a service economy, and I hate to turn care into a service, but it is a service, and with an ageing population, but also in the client group that we work with, much better medical care, meaning that many more young children are surviving traumatic births and growing up with lifelong care needs and much longer life expectancy, down to the great care they're getting. It means more and more people are going to be working in care, you know, we will need to address that workforce issue, training, support, and you know, bringing people into the sector who perhaps haven't thought about working in it before.
Thank you. And Storm, anything else from you?
No, nothing else to add from me, I don't think. I just wanted to say thank you for sort of asking me to join the call and sort of give my thoughts on the questions that you had, and looking forward to joining the Care Workers charity on Friday for the 25-kilometre trek. I might regret that on Saturday though.
Well, the weather at the moment looks okay, so I hope you'll enjoy it, and everybody else who's joining the walk. And thank you very much, both you, Storm and Paul, for your time today and for your support for our charity. And you know, I'm glad that you think that we continue to do good work to support the workforce. And I do hope that what you've said, you know, it becomes reality, that people and the wider society will support social care workforce more and more. And hopefully that will also be followed with bigger investment in terms of funding and for care workers to really feel like they're valued and respected for the work that they do. Thank you very much again for your time. Thank you everybody who watched with us today or is going to be watching online at a later date, and have a lovely afternoon.
Thank you.
Bye-bye.
Bye.